Hi, you guys. Welcome back for our daily practice questions. As always, I like to get into my introduction and disclaimer before getting started with our questions for today. So, for those of you who are familiar with me, hey, y'all. For those of you who are new here, welcome, welcome, welcome. I'm Dr. Brittany Weinstock. I am a family nurse practitioner, and I'm the founder and CEO of the Nursing Studio. I provide resources, review books, review courses, review videos, one on one sessions, and more to assist nurses as well as nurse practitioners with success on their boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success. Now, my disclaimer and reminder is that we know there's no absolute in medicine. We treat on a patient by patient basis, and any of the questions you see here, I have created and designed based on the current guidelines that are being tested on the ANCC as well as AANP exam. Now, any of the videos that you see that I have created, if I am teaching on things that we currently do in practice, I will always say that so there's no confusion. So, with that being said, let's get into question number one for today. Question number one states a mother presents to the office with her daughter with complaints of a fever and rash. She states that she has noticed this rash for the past week and it is not improving. Upon examination, the nurse practitioner notes a blotchy rash and complex spots covering the patient's trunk and arms. The patient is febrile and noted rhinorrhea. Based on these findings, how should the nurse practitioner diagnose? Is it A, roseola, B, rubella, C, rubeola, or D, hand, foot, and mouth disease? Take a moment and tell me what you got in the comments, you guys. Now, I always recommend reading the stem of the question first because it allows you to slow down to ensure that you're answering what is really being asked, right? So, here the stem of the question states based on these findings, how should the nurse practitioner diagnose? And you know what I teach. When it's asking for a diagnosis, you need to run it back and see what the assessment findings are. Look at the subjective. What is the patient or family complaining about? What is that chief complaint? What are their signs and symptoms? And then objective. What is the nurse practitioner finding? What are they stating? What assessment have they done? And then tie the picture together, right? So here, mom brings her daughter in, complains that the daughter has a fever and rash. She noticed the rash over the past week and it's not improving any. When the nurse practitioner does her exam, she notes blotchy rash, complex spots. It's covering the daughter's trunk and arms, and she is febrile with rhinorrhea, right? All right, so with peds, we have a bunch of different rashes. And in derm, the rashes, everything can kind of look similar. So I always say with these pediatric rashes, pay attention to the common theme or that thing that makes it a little bit different so that when you see it or when you get an example on your test, you know how to identify it, right? So the key thing that really stands out on this one is the blotchy rash as well as the complex spots. This should make you think of rubeola. Rubeola has that blotchy rash appearance and the complex spots. The other ones do not. They also have the associated fever, runny nose. The more as this progresses, you start to have more symptoms, okay? So the best answer here is rubeola, all right? All right, question number two. The nurse practitioner has diagnosed the patient with rubeola. Based on this diagnosis, how should the nurse practitioner treat? Is it A, symptomatic management, B, amoxicillin, C, azithromycin, or D, doxycycline? Take a moment and tell me what you got in the comments, you guys. All right, so stem of the question here states, based on this diagnosis, how should the nurse practitioner treat? I tell you, if the stem states, if they're looking for a treatment, you need to run it back and see if they've provided us with a diagnosis. And if they have not provided the diagnosis, take it a step further to look at the assessment findings so that you can come up with a diagnosis. And I know when I break it down like this, y'all are like, girl, we know that's common sense. But when you're working through questions and you're looking at all of the scenarios, all of the details in the scenario, we skip steps and we start to put pieces together and formulate our own thing. So if you take these steps backwards, this will help you slow down and make sure that you are dotting your I's and crossing your T's, right? So with rubeola, you have to understand the foundation of what it is and think about the treatment option. So asymptomatic management, yes, that's actually the answer. I know that we may think with the rash, with the fever, you might want to do an antibiotic, but there's no reason to do an antibiotic. This is a viral cause and source that causes this, right? So you want to do symptomatic management to help with the pain from the rash, to help antipyretics with the fever, and that is all that this patient really requires at this time. And it usually takes several weeks for the infection to go away. By the time you're starting to see the rash, it's already probably about 10 days or more in to from the exposure, I should say. So just make sure that this child has all the symptomatic management needed based off of what their complaints are. Okay. And then lastly, question number 3. The nurse practitioner and NP student are discussing rubeola. The NP student inquires if there is a vaccine for rubeola. What is the best response by the nurse practitioner? Is it A, no, there's not a vaccine for rubeola? B, yes, there is a vaccine. This is measles. C, yes, there is a vaccine. This is German measles. Or D, no, this is due to an insect bite. Take a moment and tell me what you got in the comments, you guys. All right, so stem of the question states here, the NP student inquires if there's a vaccine for rubeola. What is the best response by the nurse practitioner? And the best response would be what? B, right? Yes, there is a vaccine. This is measles. Remember that rubeola is AKA measles. So you know we have our MMR vaccine, measles, mumps, and rubella, right? So we do have a vaccine for rubeola. And then if we go back to question 1, let's see, question number 1, where we were talking through the things. So roseola, remember I always say the S in roseola, aka for the X. S for 6 disease, like the number 6. And the patient typically has been sick, had a high fever has resolved, and then the rash comes, the maculopapular rash, right? Rubella is aka German measles, and this is the one that has the maculopapular rash that starts at the face and spreads down to the trunk, right? So remember, rubella is German measles, rubeola is the measles, and we have the measles, mumps, and rubella vaccine for rubella and rubeola, okay? So when in doubt, know that you have vaccinations for those, okay? All right, you guys, I hope you found this helpful. As always, be sure to like, comment, subscribe, and share with whomever you may think may find this beneficial as well. But you make sure you meet me back here. And if you need any other resources that I provide, feel free to reach out to the Nursing Studio by giving us a call at 803 400 6864. You can also shoot a text message to this number or shoot us an email to the Nursing Studio, the number 1 at gmail.com. The things that I offer are the ebook and paperback option of my review book. It is broken down by system um, for family and adult gero, and it's designed for the ANCC as well as AANP exam. Colored images are provided to kind of help you tie some of these things together. I like to put things in charts so that you're able to work through and see it in one big picture as you're navigating through. There's interactive sections for each system so that you know how I teach an assessment, diagnosis, evaluation, and treatment. You can study and fill in those blanks for those areas after you're reviewing the material. Both of these are linked in the bio of this channel. I also have an on-demand self-paced review for family and adult gero. It's designed for both exams, and this is also linked in the bio of this channel. And our upcoming 5-week group course, be on the lookout for the date for that. And then lastly, the one-on-one sessions. I do one-on-one sessions either to hone in on a weakness. So if you have a particular area that you want to cover, you can do 1 to 2 weaknesses for your sessions. I do an exam readiness assessment. That's another type of one-on-one session. And then lastly is the custom package, which is the most common, which is I provide you with a pretest to evaluate where you currently are. And then I design and structure a study plan that is customized for you based on the time frame that you are looking to allot to studying. And then I work alongside with you so that you can be successful on exams. Now, I always get the questions on what do I think you should do? Which one should you have? And I always say, especially for the one-on-ones, make sure you just give us a call, shoot us an email, whichever you are most comfortable so we can gauge where you really are so we can walk through it. But if you have been struggling doing this independently, then yes, I do feel like you should find some type of source to help guide you through. But just be honest with yourself with where you are with your studying. You don't always require, and you don't need tens and thousands of things to prepare. Get you some stuff, stick to one plan and work through. Multiple things just add to the overwhelming load. I'm big on eliminating the fluff and tying things together. So, again, if you're on the fence and you're trying to see what you really should do, always reach out before trying to sign up or before buying 10 different things. Okay. But all right, you guys. Again, I hope you found it helpful. Y'all know what to do. Make sure you meet me back here. Happy studying. Bye, y'all.